Hello friends, today we are going to discuss here about rheumatology MCQs for MRCP part 1, 11 till 20 number MCQ. 1 till 10 already discussed. So a 20-year-old woman referred to you with photosensitive malar rash, oral ulcer and joint pain. You think she may have systemic lupus erythematosus SLE and carry out some immunological test. Which of the following antibodies come positive would not increase your confidence in the diagnosis of SLE? ANA, anti-Smith antibodies, anti-cardiolipin antibody, anti-proteinase 3 antibody C-ANSA, anti-double stranded antibody. So guys, answer here is C-ANSA. Why? Because C-ANSA is not positive in SLE. This is positive in which disease? In vasculitis, that is Wegener's granulomatosis. So hope it's clear now. A patient present with symptoms suggestive of Raynaud's phenomena, and on further questioning you suspect she may have systemic sclerosis. Raynaud's phenomena, okay. What feature of this condition is used to differentiate the limited from the disease of diffuse? So which feature differentiated this is limited or diffuse systemic sclerosis? If any symptoms other than the crust symptom calcinosis, Raynaud's, esophageal dysmotility, sclerodactyly, telangiectasia are present, it is classified as diffuse disease. If it extends above the knees or elbows or below the neck, it is classified as diffuse. If any organ apart from skin is affected, it is classified as diffuse disease. The presence of lung disease make it classified as diffuse disease. Presence of renal disease is classified as diffuse. So guys, answer is very simple here. If it extend above the knees or elbows or below the neck, it is classified as diffuse disease. Now, in clinic, you see a 45-year-old woman with severe rheumatoid arthritis. You considering treatment with anti-TNF such as infliximab. Which of the following statement most closely reflect the NICE guideline for its use? Treatment has failed to disease-modified agent including methotrexate. It should be first treatment given after diagnosis to prevent joint damage. Severe disease at onset, example disease activity score DAS28 greater than 5.1, more than 5 joints involved at the time of treatment initiation. NICE does not recommend its use in rheumatoid arthritis. So guys, the single best answer, these drugs like TNF, anti-TNF, infliximab, we used when the treatment has failed with 2 disease-modified agents including methotrexate. Okay. So these are very simple questions. You are looking after a patient with flare of her rheumatoid arthritis and treating her with intravenous rituximab. What is the mechanism of action of this drug? Suppression of T and B cells, suppression of T cells, suppression of B cell, inhibition of macrophage degranulation, inhibition of macrophage migration. Guys, I help you here to remember one trick on mnemonic. Rituximab and with B. So it suppresses what? B cell. Suppression of B cell is answer. Rituximab is a relatively new therapy classed as a biologic. It is monoclonal antibodies against the antigen CD20, a protein that is mainly found on surface of B cells. You are looking after a patient with Sjogren's syndrome who is positive for anti-Rho antibodies. She is 15 weeks into her first pregnancy. What complication in the fetus neonate should you be aware of that is associated with antibody? Fetal cardiac wall defects, fetal renal dysgenesis, fetal limb malformation, fetal heart block or neonatal hypoglycemia. So in this situation, fetal heart block is answer. Let's discuss why. Patient with SLE can have Antibodies against a variety of nuclear antigens, including dsDNA, Smith, Rowe, and La. The anti-Rowe or anti-La antibody is particularly associated with congenital heart block. About 1% of babies born to mother with these antibodies, either or both, are likely to have this condition. It is therefore worth being aware of this if a patient with SLE planning a pregnancy. Now, which of the following medication has been shown to accelerate bone loss, osteoporosis in some patients? Atypical antipsychotics such as olanzapine, non-dihydropyridine calcium channel antagonist verapamil, diltiazem, phenytoin, beta blockers, or NSAIDs. So, which drug responsible for bone loss and osteoporosis? That is phenytoin. It is established that phenytoin can be cause of accelerated bone loss, although it is not the case for the other listed medications. Alongside other anticonvulsant carbamazepine barbiturates, phenytoins can cause bone loss through mechanism treatment-induced vitamin D deficiency. Now, 42-year-old woman present with 3-week history of painful, stiff, swollen right knee. In the last month, there were 2 episodes of swelling, including the entire left index finger. These lasted for 5-7 days and resolved completely. She has had psoriasis on the scalp for the last year. On examination, there are right knee effusion and a milder tender swollen distal interphalangeal joint on right side. What is next step in her long-term management? Diclofenac, etanercept, methotrexate, intra-articular corticosteroids or oral corticosteroids. So guys, I hope this is clear. History of painful, stiff, swollen right knee. 2 episodes of swelling include entire left index finger. 5-7 days resolved completely. She has had psoriasis on her scalp for the last year. On examination, right knee effusion, mildly tender swollen distal interphalangeal joint. So this is a case of psoriatic arthritis. So long-term treatment is by methotrexate. Erosive and deforming arthritis occurs in 40-60% of psoriatic arthritis. A Cochrane systematic review supports the use of sulfasalazine and methotrexate to prevent joint damage. Now, 54-year-old man comes to the clinic complaining of acute pain with swelling over the first MTP joint, which has come on acutely over the past 24 hours. He has hypertension for which he prescribed Ramipril and indapamide, and his BP in the clinic 145/82. There is redness and swelling over the first MTP consistent with gout. His creatinine is 129 and his urate is 0.55 millimoles per liter. Which of the following is most appropriate treatment for him? Prednisolone, diclofenac, colchicine, rasburicase, allopurinol. So this is a case of acute gout. In acute gout, all options are clear. Allopurinol, rasburicase, these drugs we are not going to use. Even in acute gout, we are not going to use steroids. We can use colchicine and diclofenac. You are confused in both. Go with diclofenac. If indomethacin and colchicine, choose indomethacin. Okay. Now, given that this patient blood pressure is relatively well controlled, short course of non-steroidals is the most appropriate initial therapy. Any more prolonged therapy, however, is likely to be detrimental with respect to salt and water retention. Allopurinol may precipitate worsening of acute attack of gout, should not be started until a few days after non-steroidals have been initiated. If non-steroidals are unstable, then colchicine or a short course of prednisolone are both potential use. Sorry guys, we can use steroid for treatment of gout, but best option is diclofenac. Okay. Rasburicase is an IV therapy that can be used as a prophylaxis against acute urate nephropathy in chemotherapy. Now, which of the following T-score result from dual X-ray energy absorptiometry scanning falls into the category of osteopenia? So osteopenia is minus 1.7. More than minus 1 is normal. normal. -1 to -2.5 is osteopenia, and less than -2.5 is osteoporosis, like -3.6 osteoporosis, -1.8 osteopenia, -1.9 osteopenia, -2 osteopenia. Now, 49-year-old woman complains that she has having increasing problem getting up from low chair and climbing the stairs. She also has lot of pain in her thighs and upper part of her shoulder. There is shortness of breath, fairly minimum exercise, and lying flat in the bed. On examination, she is obese with signs of interstitial lung disease. CK is elevated 650, ESR 62. Anti-Jovan antibody is positive. What is best fits the best with this picture? So guys, here is no dermatological signs. So without dermatological signs, this indicate what? Polymyositis, dermatomyositis, polymyalgia rheumatica, Cushing disease, temporal arteritis. This is a case of polymyositis. This is a case of polymyositis. So hope it's clear. Thank you. If you like this video, put like on it. If somebody is new on my channel, please subscribe my channel. Thank you.